Okay, we'll go ahead and get started with just a few call norms. Hello, everybody. My name is Chelsea Hartness. I'm the membership manager at Mission Capital. As you're joining us, and before we officially get started with today's Nonprofit Pulse Survey presentation, just want to go over a few call norms, make sure we all feel settled here. We are super excited that instead of the 100 or so folks that we originally anticipated joining us for this call, that we've had over 600 register as of 5 minutes ago. So in order to make the call work for everyone, we have a few notes just we'd like everybody to keep in mind. So everyone has joined on mute. You're also welcome to stop your video. To do that, there's a button on the bottom left of your screen where you can control your audio and your screen access. But we do want to stay connected. I'm already loving the chat box. People introducing themselves and saying hello. I know staying connected is a huge part of this. And we want to make sure you know that we are really going to be using the chat box a lot. So please use your chat box to ask questions. My colleague, Tara Kirkland, our Chief Program Officer, myself, and other folks will be helping to surface questions, aggregate those for our presenters. As we see themes, we'll share those out during the Q&A. You're welcome to ask though as we go along, or we will have another specific call out at the end at a presentation where you can say that. If you are on your phone, our colleague Mary Markham is also here to help support the administration of the call. If you are on your phone and unable to chat, you're welcome to email events@missioncapital.org. We will be monitoring that throughout as well. So either way, please use the chat box. I'm hearing that I'm not quite loud enough, so I'm going to speak up and be a little bit stronger as well. One other housekeeping note, we are recording this call, and after the call, we'll share out the recording, the slides we present today, and a 4-page survey summary that you're welcome to share with your networks. We also want to acknowledge that there's a lot of shared wisdom in this space and on this call today. So at the end of the call, we'll review some next steps for sharing out resources. We invite you to share resources with us during that. If you have relevant ones, you're welcome to include those in the chat box. We'll review those there. We will also include some ways to share resources out in the follow-up with our call attendees, and you can email us there as well. We'll also be requesting feedback. This is new for us. As I said, we went from 100 to 600 in less than 48 hours. So we really do want to hear from you. We'll be sending an evaluation via Eventbrite directly after this session. We have lots to learn. We really value your input, and we'd really like to ask that you please take time to share with us any feedback you have about the call itself, the data that we're collecting, or anything else that you think that we should be aware of. You'll receive that via Eventbrite in your inbox right at 4 o'clock. So we'll send that one out, but we'll send a formal collection of our resources and things shared a little bit later as well. So now let me turn it over to our CEO, Madge Vasquez. And you're unmuted, Madge. Oh.
Wonderful, welcome. It's wonderful to be with all of you virtually this afternoon. Can you all hear me?
Mm-hmm.
Great. I'm Madge Vasquez, CEO of Mission Capital, where we are working to equip and connect mission-driven leaders, organizations, and networks as we all work to advance equity and opportunity in the midst of this global pandemic and crisis. And today's webinar is a collective effort of 12 nonprofit organizations that we're really proud to partner with. And you'll see their logos on the next slide. We're thrilled to partner with ACC, Center for Nonprofit Studies, Financial Literacy Coalition of Central Texas, Giving City Austin, GAVA, Good Measure, I Live Here, I Give Here, Impact Austin, Decibel Austin PBS, Measure, Notley Ventures, One Voice, and United Way of Austin. And although Mission Capital is hosting this call, the survey data we're presenting would not be possible without these 12 partners and without all of you who have provided valuable input. And we really came together as ecosystem partners because we were all trying to understand the unprecedented nature of this COVID crisis and how it was going to impact public health, the economy, our community, and our nonprofit sector as a whole. And we felt it was really important to quickly gather community data and not duplicate effort. As we all know, in Austin, we are all data-driven, and we knew that this was an unprecedented time of need and that required quick response. And so we quickly mobilized as 12 nonprofit ecosystem partners and worked together to create this survey tool. And you'll be hearing about the initial findings today. And so again, just want to thank all of our partners. The overwhelming response to this call shows that we're all seeking to understand how to lead and serve our communities through this important COVID-19 period and really beyond. And I'm thrilled to share that on this call, I think at registration, we had over 640 representatives of nonprofits, all levels of staff, private funders, government leaders, intermediaries, et cetera. And we're just really delighted to have you all with us this afternoon on the call. And so as I turn it over to our esteemed colleague, Rita Taylor, to walk you through the data, I want to say that we really see our role as helping to be a bridge and a connector with our nonprofit partners, with funders and intermediaries supporting Central Texas. And we're thrilled to have diverse voices at the table from multiple sectors on this call today. And just a couple of disclaimers. Please be patient with us as we're doing our best to quickly assess needs and connect folks to info and resources. And we're learning alongside you all in real time. And so the Pulse survey that we'll be sharing today during the webinar is really a point-in-time snapshot of a certain set of questions that we asked 2 weeks ago, which, as you all know, because we're all in the trenches together, feels like an eternity in COVID time. And so again, while our 12 partners have helped us affirm the survey and really consolidate questions, what you'll see today in terms of the initial findings and analysis are Mission Capital insights. And so we just want to mention that if there's anything that that looks different, or that's all on us. That's all our interpretation and observations and analysis. So you can ask us questions about that at the end or separately. And without further ado, let me turn it over to Rita Taylor, our Senior Consultant for Data and Evaluation, who has worked really hard over the last couple of weeks with a team of Mission Capital staff and our ecosystem partners to bring this analysis to you. Rita?
Yeah, thank you so much, Madge. So this has definitely been an organization-wide effort at Mission Capital to be able to bring these results and insights to y'all. And I'll dig into that a little bit more as we go. But first, I want to kind of explain, how did we actually get here with this survey? Back on March 17th, a group of about 12 organizations and intermediaries and stakeholders locally got together on a Zoom call and had a conversation about what are the needs in the community in the nonprofit sector. And so we also were hearing that there are lots of surveys going around. People are kind of being inundated with surveys right now as people try to better understand the need. And so we decided to, rather than duplicate efforts, we would work together to produce a needs assessment survey to go out to folks. And so Mission Capital backbone to that role, designing, disseminating, and the survey, and then analyzing the data and producing insights. And so the survey launched on March 26th. Data collection closed on the 31st around 5 p.m. And we had a total of 525 responses, but we were also trying very hard to control for duplication in the responses. So at the end of the day, we analyzed about 458 responses unduplicated. There are lots of caveats to this data, which we're not going to dig into all of that right now. You can reach out to us afterwards if you want to know a little bit more about the data, though. So feel free to do that. And I also, when we're thinking about this survey and when it was taken by folks, I want to kind of level set on the timing, or a few different things, but especially the timing. So the survey timing, as we all know, there's a lot changing and things are moving really fast. And even during the week that the survey was disseminated, so that last week of March, that's when we started hearing more and more about jobless claim reports and about schools closing and about more stay-at-home orders. So there was a lot going on at that time that we know the experience of those who probably took that survey has changed since then, and we want to acknowledge that. We also want to acknowledge that things are still changing. As many of you may have seen, even today, as far as jobless claims, there were revisions to the previous week, and we're up to 16.6 million over the last 3 weeks. So there's a lot changing, and that's really important to be thinking about when looking at this data and the time in which it was taken. And it's also really important to be thinking about another issue around equity. So just as the timing of the survey is important, this data does not capture the compounding effects of how intersectionality and historical inequalities are playing out in the COVID-19 pandemic in Central Texas communities. Data about the disproportionate effects of COVID-19 are slowly trickling in around the country as local and state governments begin publishing data by race and ethnicity and other types of factors. And just one example is Milwaukee County. So I'm just gonna read the quote from ProPublica, and we can share these resources later. But they said that African Americans made up almost half of Milwaukee County's 945 cases and 81% of its 27 deaths in a county whose population is 26% Black or African American. In Michigan, where the state's population is 14% Black or African Americans, made up 35% of cases and 40% of deaths as of Friday morning. So these are very, we will also hopefully be seeing more data about this as time goes on. Just like the timing of the survey is important, so are these factors. All right. And one more just quick note from an NPR article. In Memphis, a heat map shows that where coronavirus testing is taking place, it revealed that most screening is happening in the predominantly white and well-off suburbs, not the majority Black lower income neighborhoods. So there's a lot of information that's just now starting to come out. We can better understand inequity and intersectionality as it relates to data. And I also want to make sure to point out that there's a community-based survey coming out that we will also share the link to, that Measure Austin has been backboning with a lot of different local partners. And that's to also better understand equity as it relates to the way people are experiencing the COVID-19 response and pandemic. All right, so now that we have level set it, I want to also jump into the insights of the data. So again, this data is contextual in a lot of different factors, including the timing of the survey and who is not represented in the survey. So that we feel like there are two big headlines that came out of the data. One is that our sector is going through rapid change. Organizations are pivoting to meet this need. And I think that's a really important insight that we saw, is that even in this rapid change, so many organizations are working hard to meet the needs of those they serve when things are changing. And we'll be talking quite a bit more about that in a little bit. The second big headline that we feel is important to share is that with such rapid change, social sector leaders need funders, government, and capacity builders to act swiftly with dollars, resources, and advocacy. So dollars are very important, but we also heard from organizations that they need more resources and advocacy from these particular types of stakeholders. I'm going to talk a little bit more about that in a second. So as far as our top findings or takeaways at Mission Capital, we feel like there are about 7 really high-level takeaways across the data. So one, we feel like local organizations need flexible, immediate financial support to help pivot to serve our community's fast-changing and growing needs now. We also feel like, based on the data, that organizations need more advocacy support to change policy and systems that make supporting those they serve more difficult, especially in these fast-changing times. A lot of organizations can be very nimble and pivot very quickly, but they are within larger systems that may be more slow-moving. How can the people on this call and how can others advocate and support addressing our systems both now, but also in the future? And then, of course, organizations are also looking for increased access to resources. Resources and supplies are more expensive and harder to access during this crisis, which affects budget, which affects planning, which affects the ability to serve the folks that are in need. And organizations also need funding and advocacy that helps them continue to adapt and provide support beyond the immediate crisis and during the recovery process. With the change in costs and the challenges that organizations are experiencing now, and all the data we're already seeing about how things are changing and going to change in the future, organizations are going to need support during that phase as well, not only to deliver their services, but to adapt to what some might be calling the new normal, whatever that becomes. And then, as we're all experiencing on this call right now, there is a major shift in how we might be doing work towards virtual. Organizations need funding and resources to help adapt to virtual work and service delivery. And then, of course, without intentional support, historical inequities are at high risk of deepening in this crisis. It's an important factor for us to remember as we think about all the data that may not actually be available right now. And then finally, we feel like another key theme or insight is that organizations need help for their staff and operations as they adapt and navigate constantly evolving environments. This includes things like HR guidance, financial guidance, mental health support. Organizations in the survey referenced all sorts of things that they need, just guidance to be able to manage the current circumstances, but others as well in the future. All right, and as far as like top referenced immediate concerns for organizations, we asked organizations and in the survey, as COVID-19 intensifies, what are your immediate concerns for carrying out your mission and caring for the people you serve? And the top themes that emerged were a need for finances to be covered during this time, paying for operations or flexible funding. Organizations also were very concerned about their ability to actually provide services. And then finally, another top concern were that organizations and leaders were concerned about the health, mental health, and safety of their staff and volunteers, and also the people that they serve. We also asked nonprofits in the survey what resources could local funders, capacity builders, businesses, and government entities provide that would help their nonprofit respond to the challenges created by the pandemic. And the top themes that we saw were funding operations and flexible funding. We also saw folks wanting just more funding in general and more accessible funding that's easier to access. And then of course, support for basic supplies and resources in supporting that transition to virtual work, both in delivering services and then also for the people who are providing the services and receiving the services. And just to kind of give you context about the qualitative data in this survey, so we had 4 open-ended items in the survey, which meant thousands of pieces of data we had to cull through. And we had a team of 5 staff who used a code book to identify top themes for the sample, and then also developing new themes and insights. So it was a pretty robust analysis. And on top of all of this theme of pivoting, as we understand the concerns of organizations and we understand the resources and needs that they have, it's important to point out that in our survey, we identified, 222 respondents indicated their organizations have changed their operations or services to more directly support COVID-19. It's a lot of organizations, and of course, it's just reflecting one point in time, a snapshot. But I think it's a key indicator that our sector is shifting and folks are responding to the need. So we also did a lot of more quantitative questions or questions that could be quantified. And so we asked folks, what's the impact? And we had a lot of items to try and gauge this. We found that 49% of organizations were experiencing increased demand for services or support from their clients and communities. Again, this survey was the last week of March. We also saw that organizations, at least over a third, were experiencing a significant expansion in the types of needs that their clients or communities have. And these organizations are also experiencing significant disruption. So almost 80% of the respondents indicated they were experiencing disruption, or organizations were experiencing disruption of the services to their clients and communities, of their services. And then almost 36% were experiencing an inability to meet the deliverables of existing grant requirements, which is also very important when we're thinking about flexible funding and reporting requirements. And then 35% were experiencing staff and volunteer absences. So as organizations are seeing disruptions in the way they deliver and in the way they, and in the needs of their clients, they're also having challenges in being able to deliver that themselves with staff and volunteer absences, as we're all experiencing stay-at-home orders and other types of things, and social distancing and efforts to keep us all safe, including those we serve. We also wanted to ask a few questions about financial impact. So 65% of respondents had at that point experienced cancellation of fundraising events. 57% had experienced reduction in earned revenue or fee for service, and 55% experienced reduced individual donations. And of course, almost a fifth, or over a fifth, 21% had at that time experienced reduction in grant funding. So a lot of this, especially the first three items, that can be used for operational funds, which kind of reinforces the need organizations are saying around flexible operational capital or unrestricted capital. And then of course, we've also already talked a little bit about staffing, but at the time of this survey, nearly 25% of organizations had experienced reduced staff hours or instituted furloughs and layoffs. And over 20% had instituted hiring freezes by this time. So as this disruption's happening, as need is expanding, again, we're experiencing challenges in being able to deliver services with staffing as a sector. And then of course, we've already mentioned this, but organizations are definitely experiencing challenges around technology. So as far as respondents are concerned, 58.5% indicate they're experiencing challenges related to staff and volunteers needing to work remotely. And almost 40% are experiencing challenges having the right technology to do their work. And then finally, we want to dig into some of these more, these additional critical concerns. We asked two questions trying to understand organizations' financial capacity. And we're just sharing one here because the other one, the results are very similar. But one item we asked was, assuming no significant additional investment or support, how long do you estimate your organization could operate at current capacity with your current expenses and income? As you can see, and this was again, the last week of March, a lot of organizations may not have the operating cash to be able to not only get through the immediate crisis, but then into the recovery phase. What will our sector look like if we don't have the nonprofits and other organizations and community organizations who are able to support the growing needs that we will have now and in the future? And then finally, we really also want to talk again about historical inequities. So respondents described a wide variety of concerns about the disproportionate and compounding effects of historical inequities for the folks they serve. And just a few examples are people of color receiving unequal healthcare and treatment, low-income children and elderly who cannot access digital services, homeless populations who cannot shelter in place safely, and persons with disabilities who cannot access certain technologies to receive services, persons involved in the justice system experiencing delayed cases, and further isolation of immigrant and refugee communities. Again, we are also seeing a lot of pivots by organizations to try and address these challenges, but there's still a lot of concern about what this means, the compounding effect of intersectionality here in our community for those in need. All right, so really quick, who took this survey? Generally, you see that there was a pretty broad range of mission areas represented in the survey, with health and human services being the largest group. And again, you'll be getting this deck, so you'll be able to see some of the details in the notes, but there are a lot of other organizations, education, and then another category as well. So, and again, just like with mission area, the budget size is quite wide, and then so is the staff size and the volunteer size. I want to make a quick caveat to the staff size data. The number of people who responded to this item is a little bit lower, so we're not quite as confident about that based on some other things we saw. All right, and just a quick reminder before we jump into questions, because we're going through this data really quick at a very high level, but just a reminder of the top findings that we have at Mission Capital. Organizations need flexible, immediate funding to support their pivot now in this fast changing environment. And then organizations also need more advocacy support to change policy and systems that make supporting those they serve more difficult, especially as times are changing very fast. And then resources and supplies are more expensive and harder to access during this crisis. And organizations need funding and advocacy that helps them continue to adapt and provide support during the recovery process. Organizations need funding and resources to help adapt to virtual work and service delivery. And organizations need that kind of support on the both resource and funding side. And without intentional support, historical inequities are at high risk of deepening in this crisis. And then finally, organizations need help for their staff and operations as they adapt and navigate this constantly changing environment, things like HR guidance, financial support, mental health support. All right, that's a very quick rundown of the data or the insights that we have at Mission Capital. I want to make sure I turn it over to everyone else on this call who may have questions. And again, we're going to ask that you share those in chat. So I'm going to turn it over to Madge.
Thank you, Rita. And thanks to our ecosystem partners again and our Mission Capital team for helping us crunch the data and share these insights with you. We're here to understand your questions. And we may not have the answers, but we want to really activate the brain trust of nonprofit peers, intermediaries, and funders so that we can share what we're learning and just surface any questions that we might help connect to resources. So I'm going to turn it over to the Mission Capital team who have been monitoring our chat and questions so they can walk us through the next 15 to 20 minutes.
Yes, thank you, Madge. This is Tara Kirkland, Chief Program Officer with Mission Capital. It's so wonderful to see you all virtually chatting there in the box. My colleague Chelsea is going to be surfacing themes to respond. A quick, easy one, Rita, that we can talk about as we look at who took the survey was the geographic span of the survey. Now, our technical service area is the 5 counties of the Austin MSA, but I do believe that we had some folks who responded even outside of that area. Is that correct?
We did actually collect some information that might be able to help us with that. And yes, there may have been organizations that either have a presence here or are, but may headquarter elsewhere. But as far as the details on that kind of information, this was moving really fast and we have not analyzed that particular piece.
Yeah, so it was named Central Texas, but we didn't screen people by zip code as they responded.
Yeah, one of the things we really wanted to do with this survey, and we had a lot of internal discussion about how do we make sure that the survey is accessible, and knowing that all of the limitations we have around trying to understand the data from a sampling strategy and thinking about duplication and responses. It was definitely fast moving, and that's one of the pieces that we have not analyzed and been able to get to yet.
Yeah, I know you mentioned this at the beginning of the call, but again, some folks are chatting just sort of surprised that we didn't see more pivots, more layoffs, more reactions. So I guess a reminder again that this was March 26th, 27th, that Thursday, Friday, Saturday, Sunday, and then it closed on Tuesday the 31st. So things may have changed for folks even during the time the survey was open after they took it, correct?
Absolutely. And that actually made it challenging even looking at the data and trying to figure out what can we know? And so that's why we have the level setting at the beginning, because we know that things are moving so fast that even a survey that we quickly got out and we're quickly able to analyze, things are changing.
Mm-hmm. We had another question about the cash reserves slide that we had, and just a curiosity of, do we think that that was sort of kind of where nonprofits were before COVID, and therefore it's probably worse now? Or were we in, so I don't know that we can answer that. And Madge, you may also want to weigh in on that in terms of, is that just business as usual, normal lack of cash flow, cash reserves, or were we already starting to see a downward trend?
Yeah, and that's a conversation that we even had internally as a team and with our ecosystem partners, that given the timing of the Pulse survey, having closed on March 31st, and just having, one-on-one conversations through our outreach calls with our own nonprofit members and clients, we were observing that things were moving very rapidly. And, I think this was probably the end of the first, beginning of the second week of lockdown for many of us, when we were just, picking our heads up as nonprofit staff, beginning to really make pivots operationally on work that we were going to pause or have to reimagine, events that were being canceled. And so my sense from kind of the anecdotal conversations we've been having with members is that some of that change and those kind of tough decisions for nonprofits were probably happening as we were analyzing the data and shortly after. which is why we're really interested in figuring out a way to kind of do another pulse survey or time it so we can figure out on a week-to-week, month-to-month basis, how are we changing and what resources do we need real time?
Yeah, and I think as resources are changing, like the cost of resources, we saw in some of the qualitative data when folks were giving us more details about the challenges they were having or concerns they had. The cost of serving in this time when needs are going up, that could also be affecting cash flow and financial capacity. So I think there are a lot of factors influencing this. And while we cannot predict from the data that we used what the change may be, I do think those other contextual factors are very important to be thinking about.
Easy one for you, Rita. Just a question about, do those 458 responses represent unduplicated responses? So 458 organizations, and how many responses did we receive?
Yes, so we received 525 responses total. 40. So we had an option for folks to opt in to giving contact information, and the contact information was only to be used to share information about resources or funding opportunities and things like that. So we did not use that contact information to analyze the data. We only used it to try and remove duplication. So we were trying to gather information by organization. So we removed duplication by individual respondent, and we removed duplication by organization as well. And we had 43 respondents who did not provide that contact information we could use to evaluate duplication. So the 458 includes those that we couldn't determine duplication, and it does not include duplication by organization.
Great. A lot of questions about funders, and have funders seen this data, and what are we seeing in terms of how funders are responding? And so, Madge, I wonder if that's one that maybe you want to speak to, since you've been in a number of calls, and of course we do have funders on this call. Would you like to speak into that?
Sure. And so what we can share is, I think early on during the first week that most of us went into lockdown and shelter in place, we were really just assured by some of the anchor funders in our Central Texas community who began making pivots. And so we have been in discussions with some of our Good Measure philanthropic funders, which is a collective group of funders at Mission Capital, just backbones as a capacity builder. And early on, they made the commitment to influence their own peers to really pivot programmatic funding to general operating funding and making it more flexible. And so that was a really bold move that we appreciated as a nonprofit sector to allow the flexibility that we heard through the nonprofit survey that's very much needed to deal with emergency situations and to just plan. And so we're seeing that more and more, a move from programmatic to general flexible funding. We've also been seeing our partners at Austin Community Foundation and United Way. They had their Altogether Austin, Texas fund. We heard from them that I think that fund now, the fundraise is at $4 million, and they'll be sharing more details about that. We have other local relief funds that are emerging. And so just want to encourage everyone, if you haven't yet, to just keep on having those open, transparent conversations with your funders about what we need in this moment.
And I know right before this call, St. David's Foundation did announce a new $10 million emergency response fund as well, just within the past hour, right? So y'all are a very action-oriented group. We're seeing lots of questions about yes, and what next? Are you planning on doing more of this? And so just want to assure you that part of what we want to do is find out from you all what would be most useful. Our sense is that some kind of an ongoing pulse check of what nonprofits are needing and experiencing that could be matched up with what funders and folks who want to support the nonprofit sector could do would be useful. And so that's something that we want to reality check with you guys. Yay. I'm also seeing that the Austin City Council did approve the $15 million emergency response fund. So that's another great initial response from funders. Let's see what other questions you all are interested in. Yeah, I think, Rita, this whole question around advocacy and kind of collective voice, and as you maybe think about those thousands of qualitative responses that the team coded, were there specific things that sort of came to mind in terms of, besides what we talked about flexible funding, removing barriers, getting resources out the door now, anything else you would say that stood out in terms of advocacy?
Yeah, I think that, so one question we did ask is, and just to kind of give clarity on the thousands of entries, for anyone who's done qualitative analysis, sometimes folks give really detailed responses and sometimes they don't. And so coding that is a lot of fun. And one of the questions we asked, which we pivoted kind of at the last minute actually on the survey, was who else in the community, and I can't remember the exact phrasing of the question, but what groups, organizations are you seeing in your communities and the communities of those you serve that are playing key roles? And we saw a broad range of responses to that. And I think one of the things that was really important there is that those responses were, again, showing the pivot that both folks who maybe nonprofits, churches, community-based organizations, faith-based organizations, businesses. There are a lot of organizations who are building collaborations right now and trying to find creative ways to pivot and respond to those they serve and those they may not have traditionally served, because needs are changing and the groups that they serve are evolving as well. So I think that's a really important highlight that goes along with what we've been sharing so far. But I think that's one of the keys in that particular data, and specifically about the advocacy piece and how folks on this call or stakeholders in government or funding institutions of philanthropy can advocate for supporting innovation and building relationships and partnerships that are innovative and being able to respond and pivot. Does that feel like it answers the question?
I think so. Madge?
Yeah.
Madge, you're on mute in case you're trying to talk.
All right, y'all. Yeah, going back to the financing question, I'm keeping up with the chats. Just wanted to acknowledge, I know last week was a really busy week for everyone as we were trying to understand kind of the April 1st deadline for some of the Department of Labor, Families First Coronavirus Act guidelines, and trying to figure out how to operationalize that in our organizations. And then that quickly followed with the CARES Act loan opening on April 3rd, which was last Friday. And we were all doing our best as ecosystem partners to just get basic information out to all of our partners in the community. What we, as you all probably experienced, what we learned is that as the feds were unrolling or unveiling some of those legislative acts, you know, the financial institutions were in a flurry trying to figure out how to operationalize that for their customers. And so for those of you who have not yet applied, I would encourage you all to apply for the CARES Act loans, the SBA loans, the payroll protection program. And again, you can visit our website and COVID resource page for more guidelines on that. I also just saw one of our folks mentioned the Altogether Austin Texas Fund. The applications are due tomorrow. Is that right? April 10th by 5 p.m. So do take a look at that website as well.
Yes. And I think folks are just asking generally also for advice on how to advocate to their funders to be flexible in the funds and moving to general operating. I just want to reiterate for those of you who joined the call a little bit late that you all will be receiving a 4-page summary of these results, and we hope that that will be helpful to you in starting a conversation with your funders about how your needs are seen really throughout the sector and really throughout the nation. We're getting a question, Rita and Madge, not sure if you can speak to this. How do we think Central Texas and our funder response might be comparing to trends or things that are happening in other communities? Anything, any context we might be able to provide?
Yeah, Madge, I'll let you take that, but I do want to say some of the organizations who got surveys and data out earlier, like Forefront in Illinois, who did a large survey of the nonprofits across the state. Flexible funding was also something that came up for them. I'm trying to, off the top of my head, think of some other examples, but we can look up some other examples and share in the resources as well.
Yeah, absolutely. You know, I think we've been taking it day by day and just trying to provide real-time information and support to the funder community based on what we're hearing from nonprofits, and also looking at best practices across the country, as Rita mentioned. I've been in touch with some of our colleagues and peer intermediaries in Seattle to try and understand, you know, since they've been further along, how that community is responding. And so we are happy to share what we're learning in terms of best practices or other just bear traps to be aware of. I know that the Seattle Foundation was very explicit about centering equity and designing that into their relief fund. And so they chose to focus on communities that have been historically marginalized and have experienced barriers and will continue to be impacted, as Rita shared some of that national data during this COVID period and beyond. So we'll keep you posted as we're learning more, and would love to hear what you're hearing.
Mm-hmm. And someone sharing that the Seattle Community Foundation raised 16+ million and has made their grant. So they're certainly leading the way. I just hearing a lot of an appetite for continuing to make connections and seeing how there might be some creative ways that nonprofits could join forces in responding in terms of potentially shared services or efficiencies, or thinking creatively about kind of meeting this moment together. I know that has certainly come up on the community partner calls with One Voice and other folks. Do either of you have any comments? Was there anything, Rita, in the survey that you want to lift up that sort of underscores that desire, perhaps?
I think that's definitely one of the places where in the qualitative data, there were folks bringing that up as well. This desire for more connections and shared resources during this time of crisis and even afterwards. And so how do we build more connections and to weather this together and in the next phase? And how can organizations think also about those who may not be traditionally tied into the philanthropic community? How can we be more creative in connecting with organizations who are serving communities and who may be experiencing historical inequities in a different way than we often are thinking about?
Great. I think we've got time for maybe one more question or some final thoughts. I do, for those of you who may have joined a bit late, just want to remind you, we are collecting not only your questions, but if you have resources or information you want to share or update for folks, please go ahead and just chat that into the chat. And part of what our team is doing, we're going to be, as we go into next steps here in a minute, we are going to be taking this information and sharing it back out with you. And just again, as a reminder, we will be sharing the slides, the recording, and then that 4-page summary PDF of the survey results either tonight or first thing in the morning, so that you guys have that and you can use that as you continue to advocate and make connections. I do just want to remind everybody of the importance of getting the census completed as we are all trying to do what we do and serving particularly our vulnerable communities. And also reminding us about Giving Tuesday. which is going to be a global giving day on May 5th, which I know our community partner, I Live Here, I Give Here, is going to be sharing additional information on. Rita or Matt and Madge, can I just invite you each to maybe share one kind of final takeaway or parting thought from this survey or from this process of kind of hustling to try to get the survey out and in and processed and shared back out with our community. And then we'll talk about next steps.
Would you like to go first or me? All right, I'll go first. I think the process of this survey and the data that we saw reinforces the idea that it is very important to collaborate and to work together, and that having diverse voices involved in this process is vital. There are a lot of gaps in this survey as far as knowledge is concerned, and we recognize that. And we also want to acknowledge that we need to do more as a community to make sure that we are thinking collaboratively. The data, folks showed that in the data itself and in the process of creating the survey and getting it out. I don't know if we weren't collaborating, if the number of people that we reached through the survey would be the same. And even within Mission Capital, being very collaborative in how we analyzed the data and got it out. It was an organization-wide effort, and it was a collaborative-wide effort to get it out there. So I just want to emphasize collaboration, innovation, and pivoting is what we're seeing in the data, and that's just really vital in this particular crisis.
Thank you, Rita. Madge, anything you want to add?
Yeah, I think for me, you know, one of the takeaways that I've had speaking to many of you, our nonprofit members and partners, is just the fact that necessity is the mother of invention. And I've seen incredible innovation and resilience, and we are going to need all of that, and a lot of hope and compassion and love and faith to get us through this crisis. And so I just want to thank you for your innovation, for your resilience, and it is a moment where we are all going to have to take care of each other. And so I want to let you all know that we're here to support you, your staff, as we all support our community.
Thank you, Madge. And I'll just say we are so humbled by the response and the questions and the desire to connect and communicate. And as I turn it over to Chelsea to talk about next steps, I'll just say that we are open and going to be as flexible as we can in figuring out the best way to support all of you on the call. So thank you. Chelsea, I'll take it away.
Awesome. Thanks y'all so much for joining us today. Rita, if you could just go to the next slide. Just a few things as we stay connected. We've had, one more. We've know that a lot of things are changing really fast. And so we've been collecting and aggregating resources that have been shared with us on our resource page. You can find that by going to our homepage and clicking the COVID-19 image on the front page, or here's the website. We will also be sending this out in the follow-up emails. If you have questions specific about the data itself ongoing, if there are things that we can help you see, insights or analysis, please reach out. Insights@missioncapital.org is monitored for that specific purpose, and we're here to we see this as this is your data, this is your information, and we're here to share this out. So, and then if you have ongoing questions, we've really worked really hard to try to be as responsive as possible. So info@missioncapital.org or membership@missioncapital.org. We're here. If we don't have the resource, we'll make sure that we connect you with who does. So we really stand here with you. And then just a reminder, we really, really, really value your feedback on this call. So we will be sending an Eventbrite link right at 4 o'clock with a link to the survey and to the summary page of the highlights. You'll receive that at 4 o'clock. If you can share with us there. If you weren't able to add your resources via the chat, you're welcome. There's a question in the survey that you can do that on. And you're welcome to do that there. You're welcome to stay on and add to the chat. We'll be sharing, cleaning up for my typos and making sure that we share that back out so that we get everybody's resources aggregated and shared. And then we'll follow up, as Tara said, with the follow-up email that will have the slides, a recording of this presentation, the summary, and any other additional resources and links. So please keep a lookout for those.
Thanks, y'all. We appreciate your leadership. Thank you so much, and know that we're here to support you. Take care.